Welcome viewers, greetings from my clinic. Today we shall talk about refractive errors. Refractive errors, when we mean, the word refractive error means there is a need for the person to wear glasses because the eye is not focusing the object properly. This kind of refractive error can be either a minus power in the glass or a plus power. The minus power is known as myopia and plus power is known as hyperopia. Of course, minus power is far more common than plus power. We do see a lot of children going around wearing glasses, many more now than it was a few years ago or maybe a decade or two back. The common question in the people's mind as to what causes these children to wear glasses. Why are we seeing more and more children wearing glasses? Is there something to do with the lifestyle? Is it to do with watching TV? The questions are many and the answer also is many. The reason that somebody needs to wear glasses is because their eye is either smaller or larger than normal. Just like people are shorter or taller by nature the eye can be slightly longer or smaller. We are not talking about in centimeters or inches. The difference is only about in half a millimeter, quarter millimeter, 1 millimeter, rarely 2 or 3 millimeters. When the eye is longer by a millimeter, the person will need a power of almost -2 or -3. If the eye is shorter by a millimeter, they need a power of almost +2 or +3. So now comes the question. Why are children wearing more glasses? There are two reasons for it. One, we are diagnosing more children at a younger age. The reason is many. One, awareness among the school and the teachers where they notice the child is struggling to see the board and they refer it to the parents, or the parents themselves notice that the child is training to see the TV at home and goes close to the TV and watches the TV. So the misconception that watching TV causes power is wrong. We probably are diagnosing more because children tend to watch TV. So once you diagnose, then you have to have the eye tested by a doctor and have the proper glasses. Again, the next question is, even though I gave my child the glasses and he or she is wearing the glasses regularly, the power kept going up. So when the eye is slightly longer and if the child is growing, the body grows, eye also will grow and the power will tend to increase. This power will not keep increasing throughout life. It stops increasing the time when the child's body stops growing, which is usually around the age of 16 to 18. Once the power stabilizes, very rarely does it increase beyond the age of 18 or 20. That is why we wait till the age of 18 or 20 before doing any laser vision correction for any person. Now, what is the reason that children are getting this? Just the question of heredity or something else plays a role? Yes, the most common reason would be heredity. Just like the color of our skin, the way we look, or the height we achieve is inherited by our parents, the shape and size of the eye is also inherited from our parents. So if the parents are wearing glasses, either one of them or both of them, the chance that the child will need to wear glasses is very high. Rarely also, with both the parents not wearing glasses, the child may have a slightly longer eye and need to wear glasses. This is again nature playing a role and nothing to do with anything else. The second question is, why are more people getting this disorder? There are some theories here. One is that over the years, over the last 2 or 3 generations, mankind or humankind is spending more and more time doing near work, reading, writing, maybe today looking at the tab or the cell phone, and less and less work looking at the distance. So this is probably playing a role, and this is a kind of an evolutionary step that is going on, causing the eye to become longer, which gives more clear vision for near at the loss of a clarity for distance. This is just a theory, but this is a strong possibility. Second one is, over the last 2 generations, the sunlight exposure that we are exposed to as children is dropping down. While 2 generations ago, children would be constantly outdoors playing, today children are playing indoors more often than outdoors. There's a theory that says non-exposure or low exposure to sunlight causes this myopia in children. The answer, one, if there is myopia, there is no other treatment other than to give the proper glass. At an older age, you can wear contact lenses. Once you're more than 18, you can get the latest in laser vision correction, SMILE for example, and get rid of the glasses permanently. As to prevent, what can we do? Maybe we should look at letting our children stay outdoors more, be exposed to sunlight more, do as less near vision as possible. You can't tell a child not to read. Yes, do that, but let the child go out and have some activities where the child is focusing at distances also. 3. There are some eye drops that have been proven to help control the increase in power in children if it is used from a young age, particularly in children already wearing glasses. These are highly diluted atropine eye drops. Some studies show that regular use of these drops once a day over a period of 5 or 10 years may control the increase in the power that we see commonly. So, having a refractive error of wearing glass is not a disease, but it is a variation from normal. All it needs to be is addressed. One has to have clear vision. So, the proper glasses has to be prescribed and worn by the child. Later, the child has to have an eye test every year, because when the body is growing, eye will grow and the power can change. Regular eye test should be done. After the age of 16 or 18, when the power stabilizes, then you can take a decision of doing laser vision correction and being totally glass free for the rest of your life.